The UK government have been incredibly generous with us in Gibraltar, both in terms of the number of vaccine that they have supplied as well as the frequency. We have a consignment arriving this Friday and then a very small consignment after that. It's quite unlikely that we will receive further vaccine after that. Indeed, it's quite unlikely that we should need any vaccine after that. We have by this stage vaccinated almost 85% of our population. In terms of people over the age of 60, we have vaccinated 98% of the population. So the majority of the population are vaccinated. This is the final opportunity for people who've declined it so far, have not had the opportunity to make arrangements, and we don't envisage that we will have more requests than the number of vaccine supply that we have left.
In the event that you do, is there any contingency plan to accommodate those requests?
Well, I'm sure that if we were to get to that stage, it's an approach that we could make. The UK government have, of course, been extremely generous with us. But at this stage, I don't envisage that should be an issue. What is important is that the vaccine that we have is used up. And I know that there are still people who haven't had the vaccine because they are still wondering whether to have it or not. And this will be their final opportunity.
On the subject of cross-frontier workers, some might have been registered as unemployed before the cut-off time of the 31st of December. Now that we're unlocking, they might be employed again. So how can the government ensure that those people don't fall through the cracks and not manage to get the vaccine?
Our system is very good, and our registration system at the Public Vaccination Centre are very good. What they are very focused on is ensuring that there is no abuse in who applies for the vaccine, and that people try and get the vaccine who are not entitled to it. We had a cut-off date of the 31st of December to make sure that we had people who were genuinely working in Gibraltar. Now, since then, there have been different approaches made to us where people have explained circumstances that because of lockdown and because businesses were shut, people were not working, but they've now been re-engaged. And in those cases, when the approach is made to the Public Vaccination Centre, it's considered on a case-by-case basis. The objective here is to achieve population immunity. Given where we're at and the high numbers of vaccine take-up, we're doing very well in that respect. But for the interest of Gibraltar and everyone who's in Gibraltar, if we're going to have people who are working in Gibraltar and who are in Gibraltar constantly or on a daily basis, they are entitled to the vaccine, and we want to make sure that they take it up. And that's why our staff at the vaccination centre are very experienced by now in dealing with these situations, and they're certainly there to help.
Now, students are also invited to register before Friday, but if they can't make it for the vaccine before the end of May when things start to wrap up, the vaccine will be reserved for them. Will you be offering this to anybody else who's entitled to the vaccine?
Yes, we keep the vaccine for as long as the vaccine is viable. If someone is entitled to have the vaccine, whether they are students, residents of Gibraltar or cross-frontier workers, and are unable to have the vaccine before the vaccination centre closes, for as long as they register their interest and advise us when they can take the vaccine, we will make arrangements for them. The important thing is to let us know before Friday.